A massive plan for vaccinations by the Jefferson County Public Health Department. Who will be involved, the strategy to do it quickly, the plan for reaching every corner of a county that covers 774 square miles. Today, a conversation with those who will implement a vaccination program that has been under discussion for weeks now. Hello, everyone, and welcome to the conversation as we once again work remotely to protect our staff and our many guests. But we are about to turn a corner here in this moment for our country, our cities, our communities, and our citizens with the arrival and distribution of the vaccines that hopefully will help all of us get back to normal. We have four very important guests on our program today, essentially the front line for COVID vaccination response in Jefferson County. They are Dr. Mark Johnson, the interim director of Jefferson County Public Health, Christine Billings, head of the Office of Pandemic Response at Jefferson County Public Health, Kelly Conroy, Associate Director of Clinical Services at Jefferson County Public Health, and Dave Mitchell, EMS Chief with the Arvada Fire Protection District. Welcome to all of you to the program. And just let me say on behalf of all of our viewers and myself and my family, how much we appreciate all that you are doing to help us get through this and help us all get well and stay well and be well as we move forward through the vaccination process. You're among the key decision makers in this process, and we deeply appreciate your presence today. So, Dr. Johnson, let me begin with you. Let's talk about the challenges of getting a program like this set up and going. What are the logistics of getting shots in the arms in Jefferson County?
Thank you, Mark. The logistics start with we need to have a vaccine, and that's been one of the biggest problems that we've had so far is having enough vaccine to do a thorough program. Then we need to have vaccinators, those who are qualified to give the immunization, to give the shot. And then we need to have a place to give it. Thankfully, the Arvada Fire Department has stepped up for us to help find a place for that, as well as other areas around the county where we are working. And then once we have that, we need all of the material that goes with that. We need to have the syringes, we need to have the cotton balls, we need to have all of those kinds of things. And then we need to have a communications program to get folks to know who can come get it, where they can come get it, and all of that. And I would just like to say that our Office of Pandemic Response with Christine Billings working on that, as well as our Community Health Services Division with Kelly Conroy leading from there, have done an excellent job working with our community partners like Dave Mitchell and the folks there in Arvada to get it set up. It's a very intensive program to get it, but we, I think, have done an excellent job in getting things set up to this point.
And Dr. Johnson, you guys have done a marvelous job. And you mentioned Christine, and this is a great opportunity then to ask Christine about manpower. Christine, how much manpower is this going to take? How much manpower has it taken already?
Yeah, every day-to-day clinic that we're operating is about 40 different staff people from across our partners with the city of Arvada, Arvada Fire, Arvada PD, along with staff members within Jefferson County Public Health. We're also getting assistance from the state health department and then outside resources that we've contracted in. But running our clinics 3 days a week takes a lot of staff people. And that doesn't even account for the 24 FTE that we have within the Office of Pandemic Response who are doing the planning and logistics, and members of Community Health Services who are taking their work and applying that to the COVID-19 vaccine and adding that on top of our day-to-day public health activities that we need to maintain for the health of our public. There is a lot of people power that goes into these. There is indeed. And I'll ask Kelly, I wonder when I pull up to these vaccination sites, which I've learned from Dave are at some junctures referred to as pods or point of distribution sites. I always wonder, where do they get all these people? And I have a question for Dave about shots, but Kelly, let me ask you, was that backbone already in place? I mean, were you able just to pick up a phone and gather everyone together and everyone just jumped in? How did that work?
I would say that that has taken years and years of partnerships and planning. Christine, I give a lot of credit to her and our emergency preparedness department, working with our community partners and developing those relationships. And then practicing exercises to get us ready for this date and time. My staff that I oversee in our clinic, our clinical staff of nurses, public health nurses, we've practiced for this as well too. So we're always ready to get vaccine into arms. And then Christine and her team has really helped with those relationships that they've worked on for so long in our community, so that when this time did come, it was picking up a phone and trying to get everyone together. It took a little bit longer than that, but we had those relationships in place in order to be able to do that.
We're just so delighted. And again, I think I speak for a lot of people when I say we worry about all of you out there face to face and point of contact. And we also worried, I was telling Dave, we worry about shot givers. So I asked a physician friend of mine, I say, how do you find people to give shots? Do you just go out there and recruit people? And what do you call them? And Dave, my doctor, told me we call them not journalists, people who don't normally give shots. But you told me that actually, and let me repeat, I've watched EMTs give shots. It's an amazing thing. They just kind of throw them like darts, hit the right spot. They're so fast and so practiced because they do a dozen of them, I'm sure, every day. But I'm wondering, let me ask you about shot givers. Is that an easy thing to recruit and train?
Well, I feel like that, EMS workers across the state have been, part of the response along with other healthcare workers, to COVID from the very beginning. And so it was a natural transition for them to be asked to participate in this phase of the response as well. And EMS workers, paramedics and EMTs are routinely trained in the administration of medication administration through intramuscular injections. And so it was an authorization from the state health board that allowed us to allow additional EMS workers to give those shots in this setting. But it's a pretty easy lift. The public health nurses do a fantastic job of just-in-time training at the location to make sure that folks have the skills down, and then they do some direct observation of our personnel for the first few administrations to make sure that the education they just gave sank in, and it's been pretty successful so far. So, the men and women that work in EMS are a Swiss Army knife of skills, and in this setting, they're just the right tool to partner with public health to get this done to as many people as possible.
Yeah, they're amazing people. And my new favorite term of the day is POD, point of distribution. So I don't know if that's for everybody or not, but I'm going to coin the phrase if somebody hasn't already, and use that and make it part of the new vernacular. I'm just wondering now as we go forward, Dr. Johnson, here comes the big push, and a lot of discussion on the state level about getting warning now from the Biden administration about when vaccines are going to arrive and in what number. So our hope is that there is a bigger push coming. So Dr. Johnson, I'm wondering, is that what you see, and is that what you're planning for, and is that what you're hoping for?
It is what I see, Mark, and it certainly is what I am hoping for. Actually, last year, around April or May, when this all started, our staff began thinking about what are we going to do for a mass vaccination program, began working with our community partners. And at the state level, also, they began reaching out, looking for areas and folks who could help do this. We cannot do it by ourselves. We do not have the resources in local public health or even at the state health department to do this. And so we have, as you already know, reached out to the healthcare systems, to the hospitals. They are the largest ones who have the most ability to both have those who can vaccinate and have the electronic health records available, those kinds of things, so that they can keep good records and then can also reach out to their staff and to their patients. On top of that, we are reaching out to pharmacies. Pharmacists are also those who can give them, and there are pharmacies in every community. We also are working with as we mentioned earlier, our emergency medical system. So we are reaching out everywhere we possibly can to find those who are trained, are available, and have good contact with the public. It's a huge undertaking. We're talking about, in Jefferson County, 580,000 people who live there. We're trying to get as many as possible vaccinated. And so we need a lot of partners in this process, and that's what we're reaching out to.
That's fabulous news. And Christine, as Dr. Johnson mentioned, you have a lot of people. Jefferson County has the largest senior population in the state of Colorado. So it would seem to me, as Dr. Johnson mentioned, that it would only be logical that we get the pharmacies involved in this. Everyone has talked about that. There's been so much discussion about Walgreens and CVS and the Kroger and Safeway pharmacies. And is that still what you see and what you're hoping for, that we somehow get a lot of those neighborhood entities involved to expand the base for shots?
Yeah, absolutely. The federal pharmacy program has been focused on our skilled nursing and assisted living facilities. And I'm pleased to say that as of yesterday, I heard on a call that all of the skilled nursing facilities in Jefferson County have received at least their first dose of vaccine, which is wonderful and absolutely outstanding news. That, unfortunately, is only a small piece of the large puzzle. We have a very active and lively and large, as you mentioned, senior population within Jefferson County. According to the state demographer's office, we have over 64,000 members of our population within Jefferson County who are above the age of 70. That's a really, really big number. We've hit with at least one dose of vaccine, excluding the federal pharmacy program, about 5%, 5 to 6% of them already. As we have more vaccine availability, we're working hard with Safeway and King Soopers, who are other retail pharmacy partners that we have, to get vaccine to where our senior population is familiar with receiving those vaccinations. That is a strong tool that we have embraced within our preparedness program and within our health department, is to utilize the strength of community partnerships, community organizations who interact with this population all the time. That population knows and trusts them. We don't need to build that relationship. We just need to leverage and utilize the strength of that relationship to share the information, share the power of partnerships really within our senior community to get them vaccinated as quickly as we get vaccine into our county.
There you go. You guys are so connected, and I've seen you do wonderful work with your seniors. Kelly, Christine mentioned the size of this group. I have a friend in Lakewood who told me how hard it is to get a vaccine. Everybody's trying to get an appointment. As you guys know, everybody's scrambling. He says, at this point, I'd let my 7-year-old granddaughter give me a shot if she, could acquire the vaccine and walk it over. He says, I just don't care. He says, at this point, anybody who's got the vaccine, if they could just wander over and give me a shot. But then I have other older friends who still have some trepidation about it. They talk about, oh my gosh, we're first. They're pretty much first in line for it. They've seen a lot of death in their age group, and so I started to sense for some people in that age group, 70 plus, it's kind of a heavy lift. Am I wrong about that? Is it a hard thing reaching out to that population sometimes?
Absolutely. And I also want to say we have so much empathy and compassion. We understand the frustration that people over 70 right now are feeling with trying to find the vaccine. With still limited availability in the nation and in the state, we're trying to get that information out as best as possible and trying to get them those opportunities. So yes, it is a challenge in reaching the population over 70. We know that there may be some unique challenges that they have. Not everyone over 70 has access to a computer, the internet, a smartphone. That's where a lot of that information is coming from right now. A lot of the registration links are online. You have to go online in order to register. So we understand those challenges. Individuals may also have hearing impairments. They may be visually impaired, and they also have mobility challenges. So, we need to take all of those things into consideration when we're setting up opportunities for them to get the vaccine. And then we're also trying to work with community partners as well, too, to overcome some of those barriers around trying to get telephone registration systems set up so that it's not only an online registration, and trying to make sure that there is some equity in who's able to get the vaccine right now.
And Dave, on the flip side of that, and we were talking about shots, I have a lot of people who say, gee, I'd love to help with this. How can I be a part of it? And did you say to me that there are shot clinics that you guys can train people to be part of this, or is that an overreach?
As of right now, I'm not aware of the general public being allowed to participate in the vaccination of folks, and I would defer that question over to our public health partners. The extent to which EMS workers have been able to be utilized in that role, I think, has been really useful and helpful, and there's additional folks that can be tapped to do that. But I don't have any awareness of the general public being trained to be able to administer vaccinations.
Well, I'll bet you've given a bunch of them, and I'd like to see if I need training, I'm going to call you. Have you worried about your people out there, Dave? I mean, as the close contact that you guys have, all public health workers, have you worried about first responders?
The first responder community and the way that they interact with the public, I think, is really unique. From the very first stages of the pandemic, where this was just an emerging issue, through the long year that it has been since, our workers have been called and answered 911 calls across the state in urban and rural communities, fire-based and private ambulance services alike. And they do it all with compassion, and they take the hurdles that have been placed in front of them in stride. They are interacting with patients in a unique environment in their home, in an enclosed space on the way to the hospital. And it's why we've maintained that they're just a critical part of the healthcare community and deserve to be protected along with that group. And thanks to the partnerships with our hospitals and our public health partners, for the most part, the first responder community has been among those to become vaccinated. And it has provided an additional level of security, an additional level of morale, and some light at the end of a very long tunnel. And we're just, it's been a long time since I've been in a patient role capacity. And so I want to make sure to give credit where credit's due. And that's to the men and women that are out there on engines and on ambulances in people's homes, those that are really doing the hard work of EMS. And I think that it's just a really exciting time to be part of the solution, and part of this historic moment. It's just an incredible thing, and it's so important that we get as many people vaccinated as fast as possible.
And the citizens in your county and your cities, your communities, they've so embraced you for the compassion and your generosity and your sense of daring, essentially, just to go out there in the middle of a pandemic, wade right into it and do the work that you've done. Dr. Johnson, let me ask you, in terms of the work in these older communities where older Americans live, the nursing homes, a lot of assisted living communities. How's that effort gone for you? Are you nearly through it? Are you seeing additional weeks to get through it? I mean, can you give me a status report on where you might be with nursing homes and assisted living facilities and retirement communities?
Yes, I would echo what Christine just mentioned, that was turned over to some partners, professional partners who have been out doing that on a national level. And we have at this point, as Christine just mentioned, we have now gotten at least one shot into all of those who are living in those congregate care centers. So we feel that is a truly a great mark, and that is going to help. As I'm sure you know, that's where the majority of deaths have come from, those sorts of places. And so having the ability to get that first shot in does give some protection. Hopefully we'll get that second shot in very soon. But as far as a group in our population, they are ahead of everyone else in getting that first shot.
In fact, Dr. Johnson, I read that that part of our population, they are 17% of our population, but they are 80 to 90% of the death. Is that a good figure? Is that an accurate figure?
I believe that's an accurate figure. It's at least very close. And it's a lot of reasons that go into that. Number one is they are an older population who have a decreased immune response quite often. They also, for the most, being Americans, they have comorbidities that also increase their risks. And then they are living in close quarters. And so all of those things have worked against them as we have dealt with this pandemic. I think also to some degree, we were not as quick to realize what a risk they were going to be at as we moved forward. And so we were a little bit, on a national level anyway, a little bit late in seeing the risk that was there and making sure that they were well protected. I know families have been very concerned that they have not been able to get in and visit their loved ones. They've had to, speak through windows and things like that. But all of that was, once we realized what a high risk they were for getting this disease, we had to do something to try to protect them. So all of the work since the original, I think the first place that really was hit by this was a nursing home up in Washington State. And it took us a little while to figure out this was going to be one of the greatest risk populations that we have. But now, thankfully, we're getting the vaccine into them.
Yes, thankfully is right. Let me ask you another question about vaccinating that population. And this is something I just saw this morning. So I'm not a physician. I just follow the news on it. And there was information that this first shot for many of these older Americans, it doesn't give them as much protection as it would say a 40-year-old or a 50-year-old. They really have to have the 2 shots to have complete efficacy. Does that sound right?
It does sound right. And a lot of that has to do with the decrease in the immune response that we see in older folks. And so it makes a whole lot of sense that those who are over 65 actually are even more, it's more important that they get both shots. The first shot, I don't want to get too technical, but the first shot works on a part of the immune system called B cells, which make antibodies right away, but they drop off right away. And that is actually happens even more in older folks than in younger folks. And then the second shot is the one that helps to stimulate what are called T cells, the ones that last longer and actually work for a longer period in older folks. So it makes a lot of sense. And that's, again, one of the reasons we're so concerned about this part of the population.
Christine, here you are having such great success with this population, moving very quickly. And so I'm wondering, is there like a thought, and maybe this, if you want to direct this question to another member of the team, if there is, maybe there is no answer, but the question everybody has is, how long do you think it will take us to get through this group of advanced seniors and 70 over, that group of the population? Because as we've said, you have a huge population of them in Jefferson County. What do you think, what's a possible timeline for getting through that group of people to get to 65 plus?
Oh, Mark, you asked the $1 million question, didn't you?
That's the one everybody wants an answer to, even me.
Yeah, thus far, Jefferson County is seeing around, give or take, 5,000 doses of vaccine coming into the health and medical system within the county. So that's for those within the phase 1A, those healthcare workers, the first responders, and our 70 plus population. So it's a large reach that dose count has to hit. That being said, as our federal pharmacy program wraps up, those vaccine doses are going to be redirected to us at the county level. As we get more formulations online, we'll be getting more vaccine. So our hope is that we'll be able to get through this population. I know we have a wildly important goal of the end of February. I think the more realistic time frame is probably the end of March. Just due to considering access issues, equity issues, being able to reach folks who don't use English as their primary language, making sure that we have a full scope of a response and hitting all of the seniors within that population. I really think while we're aiming for February as we've been asked to do and as we need to be doing, I think realistically it will be throughout the month of March where we're still vaccinating this population.
All right. I think that's kind of the timeline everyone is hearing and planning for and looking at. Of course, everybody hopes it's much faster, but we'll wait and see. Kelly, I wanted to ask you, a lot of viewers wondering about vaccine storage and the sensitivities of these vaccines. I mean, none of us are medical people. We wander into the drugstore usually or our doctor's office to get a flu shot, but these vaccines, especially the Pfizer vaccine, appear to be so much more technical than that. I'm just wondering, what does that look like in Jefferson County? Who's responsible for storing vaccines? Are there a lot of these freezers that store at these incredibly low temperatures, or are those hard to come by? Just can you kind of give me the lay of the land on storage?
As you mentioned, there are a lot of different unique challenges that have been posed by these vaccines, and each one is a little bit different. So the Pfizer vaccine is the one that probably most people have heard about that requires an ultra cold storage, and that's somewhere between -60 and -80 degrees Celsius. So that requires some very specialized equipment. There are ultra cold freezers in the county. Most of them are in our hospitals and health systems, although we have one at the public health department as well. But not everybody has those. And so that does pose a challenge with those receiving vaccine. And so each provider, they have to be qualified by the Colorado Department of Public Health and Environment as what we call a phase 1 provider. Currently, we're still vaccinating phase 1. Once they get qualified as such, then they have to have the ability to store the different vaccines and those requirements. So it's pretty specific as far as what you need to do in order to be able to keep the vaccine. The Pfizer is the one that's a little bit the most challenging. You either have to keep it on dry ice or in an ultra cold freezer. And then both of the vaccines as well, too, they have a very specific amount of time that you must use them in. And so each vial of both the Pfizer and the Moderna vaccine, once that vial has been punctured, you have to use that vaccine within 6 hours. So that poses challenges as well, too. So the Pfizer vaccine, you can get 6 doses. The Moderna vaccine, you can get 11 doses out of that vial, but you have to be very certain about when you puncture that vial that you have 6 or 11 arms to get that vaccine into. So that creates some unique challenges as well.
That's fascinating. So Dave, when you're at a pod, a point of distribution point, how do you manage the vaccines? I mean, do you just take as many as you think you will need, or do you have storage on a truck how do you manage that when you're actually distributing it to the public?
So I immediately need to turf this question over to one of the public health folks. They're absolutely in charge of all of those hard decisions and hard processes to manage. We just show up and stand where they tell us to.
Oh, gee, you have the same job I do. How about that? Well, who would like to take that? That's a question we have for viewers. Once this stuff arrives at the site, I think they're worried they're going to get a warm dose of vaccine or something. But how do you manage this? I'm just curious to whoever wants to take the question can answer for me.
Yeah, I can take that. Our public health nurses have received a lot of training on the storage and handling of the vaccine, and they're just wonderful. So we have what's called a vaccine custodian at each one of these pods. And so that person is responsible for traveling with the vaccine, making sure the temperature is at the right, minimum required at all times. We come on site with these ultra cold or the freezers that are required to keep them at that temperature. So there's a lot of ongoing monitoring that's required and is ongoing all the time. So we bring all that equipment with us.
So I'm instantly breathing easier. So Dave, one more question about the pods. So when someone gets a shot, do you then watch them? Because I've not been to a vaccine site yet and haven't been able to get one, but do you watch them for 15 minutes? And if you do watch them for 15 minutes after they get their shot, what are you looking for?
Yeah, absolutely. And I will venture into this question as something more appropriately asked this one. So after every individual that receives a vaccination, they are watched briefly by the nurse or the paramedic that gives them the shot while they're in the internal part of the pod. And then they go out and they sit in our waiting area for about 15 minutes, 30 minutes for anybody that has experienced any issue with a vaccination in the past. And they're monitored by a paramedic or an EMT, whoever we have standing out there, and they make regular contact with them. They walk around and make eye contact and just make sure that everybody's doing well. We actually recorded a really cool post-vaccination recording that they can tune to their radio channel while they're sitting in their car and get instructions and frequently asked questions answered and that kind of thing. And it really frees up our waiting area monitors to really focus on their health and well-being as opposed to answer questions about the vaccine. And so it's a very organized process. It's a very safe process. And we are, knock on wood, doing really great as far as the number of people that require, any monitoring beyond just a sore arm. It's everybody's doing really good with the vaccine as they receive it. And we're just happy to turn out as many folks as we can in an hour. We're doing,
that's very
trying to
comforting.
get our numbers up.
Tell me again, there's a frequency for my radio in Jefferson. Tell me again that what is that? Explain that to me.
Just at our location, we set up, we identified that there were people that were asking a lot of the same questions. And so we decided to record the answers to those questions and just put them over a short distance FM transmitter that allowed us to answer those questions on a loop and freed up the people that were to be watching them in the waiting area to do just that as opposed to answer the questions.
That's a great idea. Well, Dr. Johnson, let me ask you about the variant. We know that the virus is mutating, and a lot of stories in the general press lately that it's kind of a race that we need to get a lot of people vaccinated here before this thing changes to the point that we might need another vaccine. I mean, can you, and again, I'm not a medical person, I'm just telling you what I hear about the virus. Is that happening? And is there a concern that it's going to mutate beyond the current vaccines?
There is a concern, Mark, and that is, every virus mutates. That's the way viruses survive. And around the world, when you have millions of people who are getting infected, that just increases the chance that there will be mutations. So we do have some variants. There are 3 or 4 that have been in the news lately, one from South Africa, one from the United Kingdom, one from Brazil, other places. And so far, the mutations and the variants do seem to be impacted by the vaccine. There are some questions about some of the one in South Africa. There are some question about whether the vaccine is going to be good for that or not. But to this point, what the mutations have done, it has made it more infective so that more people get infected from one person who may be infected. That is, again, very common with viruses. But to this point, at least in the United States, the variants that we are seeing do seem to be responsive to the vaccine that we have, which is wonderful news. So as you said, it is a race. We're trying to get people vaccinated as quickly as possible so that it decreases both the number of people who get ill, but also the number of variants that happen because of those increased infected people.
Christine, another $1 million question for you. So everybody wants to know, how long is this going to last? So I'm going to get my shot. Do I have to go back in 3 months, 6 months, 9 months, or is it like a flu shot? I mean, everybody wants to know, or do we know yet how long my vaccine, my 2 shots are going to last? What do you think?
Yeah, I think that's the question that we have ongoing research related to. The initial research related to getting that Pfizer and Moderna vaccine out into the population looked at how effective it was with stopping transmission of the virus. So, we're looking around a 90%, 95% efficacy for those 2 viruses. As we get more vaccine out into the public, we are able to gather more data as to how long that protection lasts within our systems. And I think that's the piece that we don't quite know yet. From my standpoint, I would not be surprised if this is an ongoing vaccination that looks very similar to our flu shots. We're going to get our influenza shot and our COVID shot on an annual basis. The nice thing about that, you asked about the variants, we'll be able to modify that COVID vaccine to meet the makeup of the COVID the COVID virus that's being transmitted within the community, or very much like we do with the influenza vaccine. That changes over a course of a season. So we do our best to align that vaccination with what we see circulating, and that ability and chance will be there with the COVID vaccine, which I think is kind of a cool piece of science that needs to be shared.
How about
Mark,
that? That's a wonderful answer. That's just one of those. I'm sorry, Dr. Johnson, did you want to weigh in?
Yeah, sorry to interrupt. I was just going to add to Christine's answer, which was correct. Moderna just came out last week and said that they have data now that their immunity lasts for at least a year, which is good news. I would not be surprised if Pfizer doesn't last at least as long, since they both are very similar. So that's a good thing, that at least we'll have the ability to have yearly vaccinations instead of having to have them every 6 months or so. It appears that will last at least a year and maybe longer.
So is that true of a really old guy like me, as opposed to a really young guy like you, Dr. Johnson? I mean, here you are in your 30s or 40s, so you have a higher efficacy than me. So are you and I going to have to get our shots at different times, or how does that work?
I think before you get your shot, you're going to need some new glasses, Mark. Yes, it does. It does. As we mentioned earlier, the immune system does not work as well in older folks as it does in younger folks. And that's why with the influenza, quite often for those who are at highest risk, we suggest that they get a third shot or a second shot in the spring instead of just the shot in the fall. And it may turn out that we need to do something like that with this. All of that is still yet to be determined.
Okay. And Kelly, let me ask you another important question from our viewers about their children. So where I live, I'm surrounded by middle school kids, and next door, there's these two great looking, healthy young kids. I think they're 15 and 13, and they both had it. They both had the coronavirus, and it lasted for like 2 days. It was like a bad cold. And their mother and father were terrified of both of them while it was going on, but it was over so quick. Young people, it's just a different experience. And so my question is, are we going to have to worry about vaccines for our kids, or do you think it's just going to be something that we can just skate by? Young children, most especially, I mean, everybody worries about their kids and even younger children, but what do you think is ahead for our youngsters, and should we continue to be so gravely concerned about them? What do you think?
I will try to answer a bit as best I can. I have to turf it to Dr. Johnson as well. But as what we know right now is the vaccines that we have available are, one of the vaccines is approved for the emergency use for 16 and above, and the other one is currently approved for 18 and above. There are several other vaccines being worked on, but we don't know yet if there will be one that's approved for children. And we don't know what that rollout is going to look like. So right now, I don't know that we have that answer quite yet. Dr. Johnson, did you have any additional information?
Yeah, I would just take this opportunity to say a lot of people say it's no big deal in kids, and so we don't need to worry about getting a vaccine. I think as we get more vaccines out, there will be some that will be will be useful in children. There is, as I'm sure you've heard, this syndrome called MIS-C, which is a rare but complex disease entity that happens in some of the younger kids, which can be very, very, can be deadly. So I do think that as we move forward and get more of the vaccines that are being studied right now out, we will find that there will be some that will be good for kids, and I will certainly encourage my grandchildren to have their shots.
As will I. Well, I must tell you, I could keep the four of you easily for another hour. You are just such a great point of information. And this has just been such a terrifying thing for so many of us. I know that I personally and many of my neighbors acquired our most senior members of our family who were in residences that got locked down, which was such a difficult thing for them. They were living in complete isolation, which is no way to live. And a lot of us have them with us, and you worry mostly about them. But everyone is looking for your help and your guidance. And I so appreciate what you're doing, the four of you, taking the risks that you do and processing all the information that you do. And I am just delighted to have you as my guest today. And perhaps here in a year we can do this again, and we can all look back on this and smile and talk about what a great job we all did in getting through this as a population and as public care providers. And I know that you're working long hours and long days and exposing yourself to a lot of folks. So let me just say again how much I personally appreciate you. And I know that most of the people in my audience feel precisely as I do. I told Dave that every night at 8 o'clock, I still go out and howl, and I left my Christmas lights up. I don't know how else to thank you. But if I could thank you all and shake your hands or give you a hug, here's a virtual hug for you, a virtual hug. Love you all. Love what you do for us. And thank you so much for participating today. I so appreciate it.
Mark, if I could just take the opportunity to thank you. One of the biggest frustrations we have had is getting information out to the community. And without our partners in the media and doing things like this, it would be impossible. So thank you for your interest in doing this.
You bet. Well, Arvada and Lakewood 8, so glad to be a part of the process. And this information will go to a lot of people. And I know you interrupted terrible schedules, crushing schedules to do this. So thanks to you, thanks to your staffs, and good luck. And I hope to see you all in person here very shortly.
Thank you.
All right. Thanks to all of you. And thanks to all of you for joining the conversation.